So welcome to the session, and I'm really glad that you decided to come to this session, choosing from all the great other that we're going to be presenting today and tomorrow. And I hope that you get your coffee, get energized, motivated to learn about the evidence and the role of evidence in the healthcare. So my name is Olga, and I work in the Behavior Change Department together with our amazing team. And what we do every day is we help our clients to design the interventions that are enriched by the evidence and research that we do also within our department and research department. So I wanted to talk a little bit about healthcare and how is it different from any other businesses that exist out there. All the other businesses, just like healthcare, provide a range of opportunities to pursue, but healthcare is very different. In healthcare, the stakes are high, the decisions are made really fast, and what you risk is life. And it is really not about the business, it is about health, and it is about life. So when we're thinking about changing something, we really need to understand first what is that we are changing. And just the fact that we are poking people digitally through the app does not mean at all that we can't harm them, because we can harm them emotionally, we can harm them economically and physically. So that's something that you should keep in mind when you're designing the experiences, and this is why it matters to everyone in this room. By applying evidence and insights in your health intervention design, you don't put people at risk. You create something that is meaningful and something that is relevant. You create something that people trust, and you can differentiate yourself among the other interventions that are out there, and there are a lot of them. You improve the project cost effectiveness, and you are able to build the likelihood of acceptance of this intervention by people who you are designing for. So there is actually plenty of benefits to applying evidence and insights. So what is health intervention design? The design process is basically the process of developing the messages, materials, and activities that target or try to aim to influence the behavioral and or environmental factor in order to promote health or reduce the risk that causes that bad health outcome. So there'll be a lot of questions as we go through the process. And the questions that start to occur is, should it be an app at all? Or is an app not the best solution? And are those factors that I'm trying to target even connected to this bad health outcome that I'm trying to reduce? What should people do differently? And how strongly are those factors related to this particular behavior or outcome? You will also ask the questions like, can the desired improvement be achieved at all? What is basically the best thing that these people can hope for? Can they hope for curement, or are they just going to get better a little bit? And all these questions can be answered with the use of evidence and insights that you can get. When I think about designing an intervention, I think about building a house. And the reason that it's very similar to me is because there is a lot of things that are you look at those houses and you think like, well, it's very simple. It's just 4 walls, a roof, and that's pretty much it. A little bit more walls on the right, a little bit more roof and windows on the right, but it's simple. And then you start to build it and you think about the floor layout, laying foundation and putting the pipes and electricity and finding people who will do this, and ultimately making sure that this whole system function all together. And it's a system, and all those elements should come together. And you should always think about balancing between the simplicity and complexity, and maybe you're somewhere in between, or maybe you're on one or the other side. The decisions that you're making are guided by the evidence and insights that you're using, also by your budget, by your timelines, and using the evidence and applying the insights will allow you to successfully build the functional house, to successfully build the functional intervention. So what is evidence? One of co-founders of evidence-based medicine says that evidence comes from all the different places. Evidence comes from the basic medical science, evidence comes from clinical research, and evidence comes from all the effectiveness, efficacy, and safety trials. And I'm really biased because I'm a dentist, so I come from the clinical background, and I believe that clinical research is extremely important for us. But just as it is important, the meta-analysis of the existing interventions are, and they bring us the information that we can repurpose, that we can reutilize. One of the most successful current digital health intervention is based on the trial that was done by NIH in 2001 for diabetes prevention. And they didn't reinvent the wheel, basically. They just used the successful trial, and they created the beautiful experience and design around it. So basically, the healthcare data can come from different sources, and it can be something that already exists. It can be something like a raw data set, and if you are having some skills to analyze the data sets, you can go ahead and play with it and try to understand what is the analysis, what is the relationship between those variables. You can go ahead and try to use the interactive tools like the ones with Kaiser or Robert Wood Johnson Foundation. You can also go in the literature and just read the protocols, guidelines, gold standard reviews of what is effective, what does work, what doesn't work. There's plenty of sources you can use. You can use your health records if you have ones, or any information on your population that already exists. So those interactive tools that I was talking about, they're actually really easy to use. You don't even have to have any skills. Just go to this website and play around. Learn about the people who you want to design for. Learn what is their health like. Do they have insurance or do they not have insurance? Is there any particular difference if you are working for a company that is presented in different states? Is there a particular difference that you should consider when you're designing experience for people who live in different scenarios and different environments? So you can also go ahead and collect the primary data. And primary data is something that can be as easy as observing people and just taking the notes and grabbing the insights about what are those people experiencing, what are their problems, and what are the behaviors that are going wrong. Or you can do the interviews, or you can do the workshop with the stakeholders. We frequently do those before we start the project. You can design pilot studies, you can do simulation studies using mathematical models, or you can just do the evaluation of the existing intervention that no one tried to evaluate before. You can use the non-healthcare data sources, and this is one of the really good examples that I love, and it was done by my friend during her thesis project at Oxford. And I just had a really quick question to you. This data is a Twitter data, and it's from 2013 to 2015, and what it shows is the activity on Twitter in relation to the Ebola outbreak. If you could guess which number represents when CDC announced the first case in US, which number would you pick? And this is the right answer. And the reason that I'm trying to show this to you and communicate is that there is a lot of things that are happening already, and social media is not actually the healthcare data source right away. Social media is not something that we would consider as a channel to communicate the healthcare information to people, but there is so much that can be communicated because people use it to talk to each other. People use it to communicate risk, to raise awareness, and to increase knowledge. So that might be one of the channels that you would be thinking of using when designing intervention. There is another one. You can use Google Trends. And if you would think about those numbers represent the interest over time in some keywords that you could search on Google Trends. And again, keywords over time going from 2005 to 2015, and we are looking at the category of healthy lifestyle nutrition. What do you think is number one? That over time is increasing in the beginning of the year and tremendously decreasing in the end of the year. And then increasing again, and it repeats. And it looks like ECG, but it's actually just this keyword that people keep searching for and really are interested in. Diet. And you're right. And let me just ask one more question because that was easy. So what do you think is number two? That sort of resembles it, but not quite that dramatic. Again. Anyone else? You're right. So very close, very similar pattern. And number 3 is actually my favorite because it says gluten-free. And it seems like there was no interest in gluten before 2008, 2007, and then suddenly, and I think it's going to get even better over time in terms of relative interest. And point here is being that you are designing in context. You are designing in terms of existing things that you would want to explore in order to make sure that your intervention is being adopted. If you are designing an intervention to change people's behavior in nutrition, I think that knowing that they are interested in diet in a particular time of the year, all over again, year after year, is kind of important for you. So the process of health intervention design can be broken into 3 different parts: in pre-intervention, intervention, and post-intervention. As you go through the pre-intervention phase, evidence helps you to answer 3 important questions. What is the health problem you're trying to solve for? What is the group that is at risk for this problem? And what is the desired goal, or what is the most those people can achieve and hope for with your intervention being implemented? So when we think about those health problems, the important part here is to try to figure or to understand where did it go wrong, and what are those things that you actually can change. When you think about the disease, there are always things that you cannot modify, and they are risk factors as well, like age or gender or pathophysiology that doctors didn't yet or scientists didn't yet target and cannot fix. But those things are currently considered non-modifiable. Creating behavior change intervention for those things is kind of useless. So think about the things that you can change. Think about the things that you can actually affect. Think about things like self-management behavior that affect pain and functional limitations and fatigue and rheumatoid arthritis, and think about those things that you can try to change because they will make the life of these people better, and they will really create a difference. And if you go into the theories and evidence, you will be able to know that knowledge, attitude, and self-efficacy are those components that can affect self-management behaviors. And creating this environment that will provide the social support for these people will make sure that they are not feeling socially isolated, and then they don't feel depressed. And as a result, they feel less pain. So there is actually an explanation for a lot of things there. And there's a little cultural touch to this slide. Because we're looking at the target population, we'll be looking at who are those people who we want to target. Do we want to create an intervention for everyone, or do we want to design an intervention just for the small group of people? Are we targeting only those who have moderate to severe arthritis, or are we doing something that will change the lives of everyone who is diagnosed with arthritis? Or are we trying to make an intervention that will help us to diagnose more people? And the content for different types of interventions will be different, and the goals will be different. So if we will decide that we are trying to change the lives of people who are already diagnosed and they are feeling bad, we will be thinking about, okay, what is the best we can do to help them? If we do the best of the best, can we say that they will be cured? In this case, unfortunately, we can't. So the best that we can hope for is low disease activity or remission. And the way that we will learn about this is by looking at the evidence and insights that tell us that, unfortunately, even with the best biological treatment, we can't cure them. They would still have to be using the medication and be adherent to it, because as soon as they stop using it, they get worse. We would be able to tell them that physical activity and occupational therapy makes them feel better, and we will try to design an intervention that integrates all of those good pieces that we know work together in order to help the patient feel better. Ultimately, the evidence and insights during the pre-intervention phase help you to answer those questions. What is the health problem? What are the risk factors that we can't change? What is this group of people who currently experience the problem or who are at risk for it in the future? And what is the goal that we are setting for them? And how can we achieve it? We go into the intervention design phase, and I think that this is one of the most important pieces because that's the core of your intervention. You learned about the problem, you learned about the people who are affected, and you learned how you can make their life better. Well, now it's the time to design, but not yet, not before you understand why those people are engaging with this behavior in the first place. our brain is really complex, and there is a range of ways it can go right or wrong, and there is a lot of emotions and irrationality, rationality involved in this. So we really need to understand why people do certain things or don't do certain things. So what is the logic of change for this particular intervention that we are developing, and what are the best ways we can apply those things together? This is not as scary as it looks like, because the only message that you should take from this is that the quality of your intervention can be defined as a degree to which the effective methods and strategies, like goal setting or action planning or instructions, apply to the relevant determinants like knowledge, self-efficacy, attitudes, to the behavior that you're trying to change. And this is just one of the approaches that makes your life easier, because you are constructing the system. You're building the intervention, and you're not forgetting that what works is the middle part. What works is actually the logic of change, because when you are trying to build an intervention that is supposed to change human behavior, you should know that no behavior is changed by trying to change behavior directly. Those methods and strategies are applied to determinants. And determinants, they come from theories and frameworks, because we look at those theories and we learn that knowledge is connected to self-efficacy, and self-efficacy is connected to attitudes, but only when applied to consuming fruits and vegetables. For some reason, it does not really apply with the same kind of correlation with other interventions. And that's why it's really important to think about every different intervention individually. Thinking about developing an intervention that will fit to all of the kind of different problems you try to solve is really complicated, because you would have to think about all of the list of different determinants that will be connected to the health outcomes on one side and methods on another side. And another problem that you will face is that those methods and strategies are very generic. They will tell you goal setting, problem solving, self-monitoring. And even if you're sitting right now in the room and trying to think about this, there is like 100 different ways you can translate it. And translating those methods in the language of your population is really important, because when you'll be thinking about all of those pieces, like what are the strategies that I'm going to use in order to change the behavior of the group that I'm targeting, just knowing that people should practice a behavior is not enough, because if you would not translate it to the language of your population, you will end up developing a mobile app that is targeting increasing fruits and vegetable consumption in the population of people who don't even have access to supermarkets. And this is really important to know, because whenever you're designing an app or whenever you're designing any kind of intervention, you should be thinking in terms of a larger system. And the largest system is something that people currently are living within. The largest system is their environmental and social context. A larger system is their resources and opportunities, and you overestimating them is basically a mistake, because you're building something that is a failure. You're building something that is not sustainable, and it's a waste of your resources, pretty much. So using evidence and insights during the intervention phase allows you to understand those important pieces of how and why you would change certain behavior, why people would change something that they were doing differently before, and what is the logic of change, or what is this mechanism of actions that would happen inside of the intervention. And you will be able to choose the appropriate methods, and you'll be able to develop the materials and activities that fit within your population. The last and really important piece is post-intervention. When you are going to the last phase of designing your intervention, you're looking at things like, did it make an impact? Did it change the behavior? And was it successful? And you're looking at the process. How successful was it? Did it achieve the goals that I set? And was there a dose-response relationship that I hoped for? Did people interact with an app? A lot of times, the most easy way to think about it would be engagement. Was there enough engagement with a particular intervention that I developed? Did people play with it? Did people try it out? Don't be that guy who just leaves as soon as the work is done, because the work is not done yet. You designed something. Go and measure it. Go and try to think about the things that matter, the things why you built it in the first place. You were hoping to improve the population of your people. go and measure, did you or did you not? And if you are lucky enough that you were actually using this kind of approach or any other approach, that you had a logic change in it, you're not only able to measure the health outcomes or something like fewer ER visits or lowered medical costs, which people say takes years, and it does take years for this, but if you actually have the logic of change, you're able to measure the midterm things. Because if the intervention works, because you're changing the mediating variables that are inside, you can measure those. You can measure the change in knowledge, you can measure the change in self-efficacy, in attitudes, and knowing what is the correlation, you can claim that because the group of people I was designing it for changed the knowledge, like it increased, and they believe that they can do this. You can claim that within a certain time, in 6 months, you will see the difference. So having the logic model allows you to evaluate the process. When you think about impact, you're thinking about the things that you should have been thinking from the very beginning. What are those indicators and what are those measures that you were trying to reach? What are those objectives that you were setting in the very beginning for your people? And did it achieve these goals or not? Did it improve their health or not? And how big was the change? So in order to know how big was the change that you were aiming for, you really need to look at those indicators and those measures, and it will help you to understand whether your intervention was successful or not. When you're looking at the process, you're looking, again, the most simple way to think about it, you're looking at engagement. Did people interact with it? Did they like some features more than others? When your intervention is built on the logic of change, you know what to expect, you can hypothesize, and you can think about the things that should work better than others. Combining this with getting the real numbers of what worked and what people liked will help you to iterate effectively. It will help you to understand that this thing claims to be effective in the literature, but in reality, people don't seem to like it. So what's the problem? Is the problem that the design does not truly fit with the population, or is the problem that it's not effective? You're able to create the evidence for other people who are building interventions so that you're helping not only your company, but others as well. To sum it up, using evidence and insights in the post-intervention phase helps you to evaluate the results of your investment. It helps you to understand which methods worked and which didn't. It helps you to analyze why it did work or it didn't, so you can iterate and you can change some things. You can go and seek for more funding or support. You can seek for collaboration as well with other people who hope to achieve similar goals. You can contribute to the evidence base of the science that is pretty new. So this is really a lot of different values for you. Key takeaways are that there are a lot of problems, but one of the most important things that you should try to avoid is basically try not to define the problem before you understand the problem space. Try not to go in the project knowing what the problem is. Go ahead and try to learn about it. Try to understand, try to become an expert about this problem that you're trying to solve, and then define what the problem is. If you are using evidence, know the limitation of this evidence. Don't try to jump into conclusions that you're using the randomized controlled trial and therefore it must be effective. You should really look at all the details. What was the control group like? How many people were there? And all the different other qualities of this evidence. If you don't build a logic model, the only person who does not benefit from it is not only you. Actually, you don't benefit from it, but the other person who you're intervening with can be harmed. It's a lot of risks with any health intervention that you're building. So make sure that whatever you're designing is safe for people. Overestimating the opportunities of the population that you're designing for is basically the situation with the supermarkets, and creating an intervention in the environment within it does not even fit because it will not make a difference since people cannot carry out the behavior that you're asking them. Skipping evaluation, I don't know, I think it's stupid. Because if you don't evaluate what you're doing, what was the purpose of the thing? If you don't evaluate, how can you iterate? How can you make sure that in the next round it is better? So make sure you have one. Must-haves, reduce uncertainty. When you are being transparent about the thing that you're asking people to do, they are more likely to do this because they understand, and they really need to understand what you're asking them to do. Set some expectations. Set some expectations for people what they should expect after a certain time. If you're asking them to lose weight, tell them how long it's going to take them. Establish a trustworthy relationship. It is really important because just when you decide that you're going to build something, it doesn't really necessarily mean that people are going to come. And if you're going to talk, it doesn't really matter whether you talk something interesting. People can still not listen. Provide a choice. Providing a choice is really important. You are designing an intervention and you are making an offer. Make sure that people who you're making an offer for have a chance to not do this thing. Provide a value. When you're asking for the input, make sure that there is always something for people there. When you're designing a risk assessment, make sure that people can see the value of them taking this risk assessment. And always integrate relapse prevention strategies because the only people who won't fail are the ones who won't try. In the end, I just wanted to conclude that you should design for people, you should solve for the unmet needs, you should become an expert and understand what are those needs that are unmet. You should set realistic expectations, and as the professional in this field, you should be able to tell what is the thing that I can change and how long it's going to take me to make this change. You should design solutions that are relevant, and you should take responsibility because you're working in the healthcare with people and their health. You should evaluate and iterate to make sure that your investment is worth the project and that it's making it better with every other iteration. Your intervention can look like this flask on the right, or it can look like this beautiful cure on the left, and it's up to you, and it will be different. And I hope that you will apply evidence and insights in yours. So that's a great question. I think that there are different ways you can approach it, and every time that we are talking about healthcare, medicine, behavior change, we're thinking about it as the fusion of art and science. And whenever you have a question that the science would not answer, and there are answers to this question as well, there are a lot of studies that look at the way that irrationality can be explained, or it's not necessarily something